Jaundice in a newborn is a quite natural phenomena. Most of the newborns develop jaundice by the first week of their life, and by the second week, the jaundice disappears on its own. One of the major reasons of jaundice is that the fetal hemoglobin present in the blood of the newborn gets broken down. The hemolysis leads to formation of bilirubin, and that fetal hemoglobin is replaced by adult hemoglobin. Now, this jaundice shows its cutaneous presentation by appearing as yellowish discoloration of skin and eyes. Now, this yellowish discoloration of skin has a craniocaudal progression. This yellowish discoloration has a craniocaudal progression. Based on this craniocaudal progression, we can stage the severity, or we can have a grade of severity of jaundice. Now, the staging and grading will also help us to take important decisions, like when to start phototherapy for the jaundice or when to think about higher therapies like exchange transfusion. So now there's a rule known as the Kramer's rule, which tells us about the craniocaudal skin change in the jaundice of a newborn. Now, for that, Kramer divides a neonat's body into 5 different zones. Of the 5 different zones, the first zone is the head, which represents around 5% of jaundice when the bilirubin level is around 5. Then we have the chest and upper abdomen. We have chest plus upper abdomen, which corresponds to bilirubin levels approximately 10, and this is the total serum bilirubin that we are talking about. Then 3 represents our lower abdomen plus thigh, which corresponds to a bilirubin level approximately 12. Then we have the zone 4. The zone 4 has 2 components, that is your arms and legs. And the zone 4 has a bilirubin level of around 15. And finally, we have the last zone, that is your palms and soles, which corresponds to a bilirubin level of around 20. So the levels of bilirubin in all the 1, 2, 3, 4, 5 zones are ranging in this manner, that is, they are your 5, then 10, then 12, then 15, then 20. Now, based on this severity, we can decide whether to give a phototherapy or to give exchange transfusion, or simple wait and observe can do. Now, some authors or some pediatricians do another thing. Now, based on this Kramer's rule, these are the median values. Like if your head is yellowish, then we get a median value of approximately 5 of total serum bilirubin. Now, over that, they do another thing. They check whether the yellowish discoloration is lemon yellow or it is deep dark orange, that is a orangish yellow or orangish. Then if this is a lemon yellow, they will take a lower part of that, like they will consider it to be 3 or 4 in case of head, or if this is orangish, then they will consider it to be 6 or 6.5, like that. Now, all these values that we have discussed are the median values, and this is what Kramer's rule says.